Narcissistic personality disorder is a deep-rooted and chronic distortion of self-perception marked by an intense need for admiration, a sense of grandiosity, and paradoxically, a fragile self-esteem. From a neurophysiological standpoint, individuals with NPD often exhibit reduced activity in brain regions responsible for empathy, particularly the anterior cingulate cortex and the insula. This diminished responsiveness makes it difficult, if not impossible, for them to emotionally connect with the suffering of others, especially when such connection threatens their idealized self-image. At the same time, the limbic system tends to be hyperactive in response to perceived threats to self-worth, such as criticism or neglect, triggering sharp emotional outbursts in individuals inclined toward inflicting extreme harm on others. NPD frequently appears as part of the so-called dark triad, a cluster of traits that includes narcissism, psychopathy, and Machiavellianism. When combined with low anxiety and a blunted sensitivity to consequences, such individuals may resort to manipulation, devaluation, and aggressive tactics as a means of asserting dominance or reinforcing self-image. Not all people with NPD display overtly destructive behavior, but under certain conditions, such as chronic humiliation in childhood, emotional neglect, or unpredictable parental control, a stable worldview can develop in which relationships are seen as arenas for domination, retribution, or self-preservation, sometimes with profoundly negative outcomes. One lesser-known characteristic of NPD is what's often called cold empathy, or vacuum empathy, the ability to cognitively understand the emotions of others, not for the sake of connection, but as tools for strategic influence. This can create a convincing illusion of emotional depth, beneath which lies calculated intent. These adaptive mechanisms often begin to emerge in adolescence as a defensive response to ongoing invalidation or the absence of a psychologically safe environment.